Hi, I'm Dr. Tanya, and welcome to Mommy Calls, your go-to source for everything pediatrics. Today's topic, sore throats. Sore throats can really hurt. I recommend popsicles and pain medication. The most important thing is that you encourage your child to drink fluids, so that way they stay hydrated. Now, luckily, sore throats under age 3 are usually caused by viruses, and they will get better on their own. A common viral infection we see is hand, foot, and mouth disease, where your child can have very painful sores in the back of their throat. They can also have tender bumps on their hands and feet, and sometimes a rash in their diaper area for infants. It's very contagious. If your child has a fever that's lasting for more than a few days, if they're refusing to drink fluids, or if they look really sick, make sure you take them to your pediatrician's office to get checked out. Over age 3, and once in a while under age 3, especially if there's a sibling that has strep throat, then we see strep throat. Strep throat is a bacterial infection of the throat, and this is an infection that does need antibiotics for it to get better and to prevent long-term consequences. Typically, strep throat presents with a high fever and a really sore throat. However, sometimes in little kids, their throat may not hurt very much, and they may actually have a sore tummy. They may even throw up. If your child has a lot of coughing, runny nose, then that's more typical with viral symptoms, and we don't often see that with strep throat. If you're concerned that your child has strep throat, you really need to go to your doctor's office so that way they can get checked with a rapid strep test that's done in most offices now in just a few minutes. To treat strep throat, your child will need antibiotics. And once they've been on antibiotics for 24 to 48 hours, once their fever is gone and they're feeling better, then they can go back to school. If you have any questions about your child's sore throat, if their throat hurts so bad that they're not drinking fluids, if they have a high fever or they look really sick, then be sure to call your own pediatrician. I'm Dr. Tanya with Mommy Calls.